my name is Penilla Gunther. I'm from Stockholm, Sweden, and I'm based here with my company and my activities called Focus Patient, a meeting place for life science and healthcare. And I'm born in 1964. I'm also grandmother nowadays to two small boys. Henry is 2.5 and Felix is 9 weeks old. I think I had a very special journey with my heart failure because I wasn't aware of the diagnosis at all. I felt maybe I had a bad flu, and it was, like you have maybe pneumonia, and you feel that you are very, like a big cold, and you cannot breathe properly and so on. And I had a period where I had changed my job, and I had a new job where I really wanted to, show what I could. And I think I didn't really, recognize any symptoms because of everything else around me. So when I had to be home for a few days because of a flu, which I thought it was only, it felt very bad. I'm usually not sick at all. So I went to emergency room and suddenly I couldn't breathe. It was a very sudden experience that I couldn't breathe, and because of course everyone, including me, I thought it was something with the lungs because I couldn't breathe. And the day after, still at the hospital, of course, the doctor told me that it was a heart failure, and it was very, very, very bad. I had only, around 20 or 30% left of the capacity of the heart. And so I went just to Gothenburg, to the university hospital there of Sahlgrenska, and had an investigation whether I could handle a heart transplantation or not. And of course, it was very, very surprising for me to know that I have a very, very bad heart failure, coming from nowhere, I thought. And then it also went so bad that I need a heart transplantation. From the day I went to the hospital and until the day I received a new heart, it took only 2 weeks.
Wow, that's very serious.
So it was really, really bad. So I had a short but intense experience.
Yes, basically your life changed in 2 weeks.
Yes,
massively.
I could just throw my calendar out of the window, and I understood immediately that my life would change forever, and I didn't know if I could, if I should survive, or if I could, handle my future at all. If I even could, see my children grow up or something like that. So it was really life-changing.
Being a young person, you always put it on, I didn't sleep well, I didn't rest well, I had a late night last night, I overworked or something like that, and just putting these symptoms on something else. And by the end of the day, when you feel really, really bad, as you said, and when you actually go to the emergency, even the doctors themselves, they weren't able to diagnose it because of the way how we look. We look completely healthy, right?
Yes.
Really beautiful,
We haven't met yet, you and I, but
our experience is very similar. Similar in terms of what we've been through with a heart failure. And and, you know, being in contact with the people who went through the similar experience is a different level of communication. The respect, you know, the communication, the support that, like, for example, I want to give to the others and support new patients who are in very difficult position now and probably waiting for the heart transplant in the future.
I don't know about you, but I have met so many people who have, you know, approached me and have talked to me about any CVD, you know, heart valve diseases. They have been experiencing a lot of different types of cardiovascular diseases because of the fact that I have been very open about the cause of you know, it started with a heart failure and then it led to a transplantation, and I think that is very important to know. It just doesn't happen all just by itself. It has a reason. As I said, I'm very fortunate. I've been working full time. Well, after 6 months from my transplantation, I have to admit, I worked only 50% for 3 months, but then all the time after that, I've been working full time, and even more than full time. I spent 8 years in Swedish Parliament, and I worked at least 160 hours a week, more or less. You know, it was crazy. There are very long days working.
I have no words for it. Like, you're very fortunate, you know, you have to take it easy. I'm doing everything in my power. That's what I'm saying. I'm doing everything in my power as much as I can to be as healthy and, you know, just take care of myself and try not to overwork, but that doesn't really happen too often, but, you know, just trying and trying. That's great.
I think the most difficult part was to understand the reason why I really got a heart failure, because I was at least quite young to receive that, and I'm quite small, not too heavy so far, and I was thinner at that time. I mean, 15 years ago, and I have never been smoking. I drink only champagne, more or less. The reason I've been told afterwards, when the surgeon talked to me about the transplantation, it was that maybe my cancer from my early age of 27, 15 years before my heart failure, was causing the treatment for my cancer at that time, maybe was the cause of weakening the heart.
And
so that's why I'm also engaged nowadays with very important areas, oncology. Because I think it's very important to know that patients who have been treated for cancer earlier in life really can face also another kind of diseases. So I think the awareness of different kind of symptoms is very, very important.
Absolutely, I couldn't agree more, you know, and even knowing your, the genetic part, just knowing what diseases you had in your family, I think it's very, very important. At least you can know and be prepared that, you know, okay, this part, maybe my heart or my lungs are weaker, might be weaker, go get tested. And then, you know, I'll follow up every 2 years or something, just to make sure I'm ahead of possible, you know, diseases who will change my life.
But I think the awareness to create awareness through information and knowledge, I think it's quite difficult symptoms. I mean, they could fit in for any diseases almost. If you get tired, you think it's having to breathe or something like that, it could fit in for several diagnoses. But
even looking at the COVID, right, with the shortness of breath.
Yeah, for example, and
so confusing.
It is very confusing, but I think at the first time when you enter primary care and you list your symptoms, you should always be asking them if it could be heart failure, at least to make every test possible to see whether it's something wrong with your heart. Maybe it's not heart failure, but it could be something else. And if you ask too many questions, it's better to do that, of course, and to discover if you have a serious illness as heart failure is, because it can also be, it can be eased, it can be relieved, it can be, if not cured, at least you can have the right treatment.
Sure. There's, like my doctors say, is like, there's no silly questions. Like, oh, I have a silly question to ask, but sometimes they are silly, but they know better. So I still have to ask because I don't know. So it's like, I have a silly question. It's like, there's no silly questions, go on. So yeah, asking questions is very, very important.
Well, the first that comes to my mind is from being at the hospital. I received many, get well cards.
Okay, yes.
And I used to put them on strings on the wall.
Yeah.
So I could watch the cards when I couldn't sleep at night, or when it hurt or something like that after the transplantation. And I brought them home at the strings, put them up in the hall, in the hallway. So every time I had to pass, to another room in my apartment, I passed these cards. And what I was thinking was that I was so blessed to have so many people who really was thinking of me. So they took their time to write me a get well card. And my message would be also to see the positive in life. It can be really hard times, even after 15 years, of course. But I think to see the positive things is really making you also to feel better, because you will always have some people who are still thinking of you and new people. So even if you don't have the cards around you, or I have them in a small box now, but I can still really think about that memory and feel very, very grateful for the experience.
That's amazing, actually. And yet it's like swiftly and smoothly just went into my last question, which I didn't need it to ask, because you actually answered it. And that was about the piece of advice for people living with heart failure and staying positive. I couldn't agree more with you. It's difficult at times, but it's very helpful to keep you in line, to keep you within your goals for your health and the management of your disease. So it's very, very important to keep that positivity shining, if I could say that.
Yes, I think no matter what kind of disease you have, or it will always be ups and downs, of course, but it's also very important to clean your environment and take away bad energy.
I absolutely know what you mean.
It's easy to say, but actually, I did that when I came home from hospital.
Mm.
I really physically cleaned out both furniture and things that have been memories in some way or something like that, just to feel that I started a new life.
It's so funny that you said that about particularly cleaning, because for my transplant, I had 2 calls. The first call, it didn't happen. So I had to wait for another call. I wasn't upset because I was so busy. I had so much work to do that, I was like, okay, fine. It means that I can continue my work and move forward. But then after a couple of weeks, I received actually the call. But that weekend, because they called me at like 3:30 on Monday, all weekend I was doing a deep cleaning of my house, like proper deep cleaning of the curtains, like everything, every corner, wiping, cleaning. And then I got this call. And when I came back home, it was already dusty because I came back home after more than a month. But it's still, I understand that wanting of having like a kind of a fresh start, like starting your new life with your transplanted heart.
Yes, and I think even though if you suffer from a heart failure and you don't know what will happen, and it feels like a long journey without ending, I think cleaning up in your life, it is a good metaphor, really, because you're entering a new life.
Refreshing and making space for the new things. And I think
Yes.
for me is the most important, because you have to let go for the new things to come in. And that's a very strong message as well. So thank you, Penilla, for this conversation. Lovely to meet you. It was nice to hear your story, and I will speak to you soon.
Yeah, thank you, and very nice to speak with you, and hopefully we will meet in real life soon.